We have with us this morning Gale, who's an FBI victim specialist. We are so lucky in the state of Iowa to have Karen as a resource. She's done 22 years of victim advocacy, and she provides comprehensive services to all federally identified victims of crime across the state, 88 counties in Iowa. And so this is a fantastic opportunity. And I think one of the things that it's important to mention here, even though we're talking about active shooter incidents or mass casualty incidents this morning, they do not necessarily have to be federal crimes in order for you to respond. So that would include if a shooting occurred or a mass casualty event occurred in a school in Iowa, we wouldn't have to be declared a federal crime in order to get resources from the FBI. Fantastic. And so Karen has had, because of that, this tremendous experience in dealing with active shooter events, including Pulse nightclub, San Bernardino, Sandy Hook, the Vegas incident. And so we want to talk to her a little bit about that experience this morning, so that as you're developing your emergency operations plans, specifically the active shooter annex, you can think about the way you're utilizing your staff and utilizing your resources. I think this is the hardest annex to write. We started, remember, back in September, encourage you to start simple, start with fire, tornado, the things that you know, and work your way towards this type of event. One, because it's extremely complex. There are many, many agencies involved in this response. And also because you're acting in both responder and victim in this case. And it's really challenging to know where your role as a responder ends and your role as a victim begins. And so we want to set realistic expectations for your staff, for your teachers, for your administrators. And we think by having a conversation here with Karen this morning, we can kind of clarify what is your responsibility, what is your role, and what are the resources that you can access, because this is tremendous. I think in the couple of years I've been working with you, I'm just overwhelmed at not only what you do and the service that you bring to the people that you work with. It's tremendous, but the services that are available, I don't think that we have a really good understanding of that. So we've got a few questions this morning. We want to talk a little bit about this from a planning perspective, how to write this into your plans, and we want to then talk a little bit as superintendents and administrators. What is your role and how do you fit into that? So let's talk a little bit about that. As schools work to develop their plans, what should their expectations be from teachers, from staff, from administrators? What kind of responsibilities and duties should they have?
Well, first of all, the teacher is in the classroom should be in control of their classroom. They get to decide what choices they're going to make for their students. What we see most of the time is the person that's in charge doesn't worry so much about themselves, but they worry about those that they are responsible for. Whether that's in the office or in the school classroom setting, the employee needs to be in charge of that arena. They need to recognize that they should have been briefed and educated as far as the process goes. Each teacher, each staff member needs to have a comprehensive understanding of what the expectations are if or when an active shooter event takes place. And that just provides them with options. And the teacher then gets to decide what's the best option within each of their classrooms for the safety of themselves, and as importantly, the safety of their children in that classroom. Immediately following the event, the teachers and staff are responsible for their children and themselves. That's really where their responsibility should end, is to themselves, to their students, making the best decision that they can when the active shooter event's taking place and going with that decision and not having to worry about being questioned about it later.
Yeah, what I hear you saying, Karen, is really just having that empowerment to know what's the right thing at the right time.
Absolutely.
And feeling good about it.
Yes, so. Absolutely. Because these teachers are in charge of their students on a daily basis. They have a huge responsibility.
Right.
And so that's not going to shift. It's just going to be heightened, and there's just going to be added chaos. But teachers are well up to the task of doing that, as long as the administration supports them in that.
Yeah, good point.
Great. As we're working through our plans, are there things that we should consider in our pre-event planning to sort of reduce the potential for trauma on our children?
Pre-event planning is always really smart. I mean, like I said, the process has to be understood, and you have to educate to the highest of levels. I think there is an unrealistic expectation that teachers are going to be able to provide services to students or be able to do more than they're capable of because they're already a victim of this crime or this event that's taking place. I think that teachers are not, they think they're going to be able to pull themselves together emotionally right following the event, and they're going to be able to be there for each student or the student's family. And I think it's okay to have that conversation with the teacher and say, you can only do what you can do. And at some point, you also have to do self-care and recognize that all the other first responders and all the other services that are in place are going to come in, play their role, do what they need to do for the students and for the teachers and the staff. So let's really break down the barrier of, oh, I need or I should do this, and really try to encourage our teachers to identify what they actually want to do following the event.
What about the teachers, staff, students at the district schools that are not directly involved in the event? Will the students and teachers at other schools in the district be impacted? How and what services should we plan on providing across the district?
Well, I think the reality is that everybody is going to be affected by it across the district. Vicarious trauma is real. They're going to either be watching it on TV, they're going to have the phone calls, they're going to have the text messages. You know, with social media as it is today, good, bad, or in between, information gets out before even most people know it. You know, I mean, if you have children in your schools that have their cell phones, so they're going to already be texting mom and dad, or they're going to be posting things to Facebook. So the trauma is going to be literally across the board. So we need to recognize that number one, vicarious trauma is real. Mm-hmm. That there are going to be people in the community who had no part or in this event, either victimization or saw it happening, was not even their own local area, and they're going to be traumatized by it, by what they see on TV, what they've heard, watching children, those kind of things. So there's going to be resources for communities. You know, people are going to reach out through churches, through different school districts, through non-governmental organizations. All of that's going to be in place for those who have been traumatized but are not a direct victim of the event.
Should we think about the future triggers? Are there things that we can do to reduce that trauma with regard to our initial efforts in response, or what can we do to make sure the next weeks, months, years following that event are not traumatic? Because we're seeing with Columbine students,
absolutely,
20 years later,
absolutely,
that they're still facing triggers. What do we need to think about?
Well, I think baseline, the administration has to think about at the very beginning of the event. How are you going to notify the school that there is an active shooter event taking place? We have a tornado drill siren, we have a fire drill horn. You have different events that take place that you train to. You train to tornado drills, you train to fire drills. And I'll be real straightforward with you. You don't set your school on fire to train for a fire drill. So I have had information presented to me that law enforcement in some schools have gone into the hallways and shot blanks so that the children would not necessarily experience an active shooter event, but at least be familiar with that so they could train to it. That to me is absolutely ridiculous. Because like I said, we don't set a school on fire to train for fire drills. What we do provide is information and education. So at the very baseline, the school has to decide what they are going to say. And I believe, just from the experience I've had, and also, you know, as a parent of when my kids were much younger than they are now, I want it to be very straightforward, where you come across the intercom system and just say, we are in an active shooter event, this is not a drill. And that is very straightforward, very black and white. And then, like we were talking about down the line, it doesn't mean when they hear that horn or they hear that code red or they associate a red color down that could trigger them in the future, or a sound could trigger them in the future. That's really important to remember. And we have to recognize that what's going to be happening during the day, people running, yelling, screaming sometimes, or complete quiet is also a trigger for some people. Watching it on TV time and time again can be a trigger. So we have to recognize that's not going to happen just in the days and weeks and months after an event, but it certainly can last for years. So there are things that can be put in place to desensitize people to that. And one of those is to go to counseling, to really refocus and reframe what has taken place. And that's part and parcel of the process following the event. I think that we have to recognize that people are going to want to talk about it, that you're going to want to vent in the classroom. You're going to want to vent to other student or to other teachers, and kids are going to talk about it. And that's appropriate and that's okay. There also needs to come a time where that's not the sole focus, and you have to re-enter the life that you now have versus what it looked like before the event took place.
Yeah, we know that's going to be, it's going to be a new normal. There's going to be a
Absolutely.
new circumstance, a new situation for which to come back to.
Yeah, and everybody reacts differently to that. You know, there's no right or wrong way to react. You're going to have people who are just, let's get back to it. I'm ready to teach. I can do fine. You're going to have people who may behave that way for the first 3 or 6 weeks, and they're like, oh my goodness, this is too overwhelming for me. There are going to be people who immediately know I need to go see somebody. There are going to be people who will leave teaching. There will be families that move away from the district. So you just have to recognize that everybody is going to work through it in their own time. But administration, I think, plays a part in recognizing that, okay, this time has passed, so these are things that we're going to put in place. Counseling will only be available now from 3 days a week, or we're going to have a 6-month kind of debriefing again, so that people don't have to solely focus on this event, because that's what we see, the re-traumatization day after day after day.
So, that's so interesting. Can you give us a sense, Karen, as to some of those events, incidents that you've been a part of? Just give us a sense of a timeline. Are we talking months, 3 years? How long are you still providing some service to some of the incidents that have occurred? I just think that I don't think we have any idea.
Right. So usually in a mass casualty event, and like Jane was speaking earlier, it doesn't have to be a federal crime to fall under the nexus of a mass casualty event in order for other law enforcement to be involved, specifically the FBI. So in the case of Sandy Hook and San Bernardino and the church shootings and Las Vegas, what happens is the event takes place. There's nothing to tell you that the event's going to take place. It just takes place. And then local law enforcement or even local emergency managers or superintendents can call law enforcement or call the FBI and say, we need additional resources. We need help. And then the rapid deployment team is deployed to that event. We usually are on the ground within 12 to 24 hours. What happens is there's a local victim specialist, at least one victim specialist in every state. Throughout the United States, there's 156 of us. So some states have up to 6. Here in Iowa, there's me, and then there's also my colleague, Sherry Schwetter, that covers Indian country in Nebraska and Iowa on the border over in Sioux City. And then there's one in, Kathy Thompson covers the rest of Nebraska. So we have a lot of ground to cover, but our population is lower. So the reality is this team would fly in and they're going to bring 15 additional, usually 10 to 15 additional victim specialists. They're going to bring support staff. They're going to bring in more agents. So by the time it's all said and done, you can have a force multiplier of anywhere between 25 and 100, depending upon what the case may be. So the victim services piece, the victim specialists that come in, we stay initially for the first 10 to 14 days. And we then provide all services, resources, referrals, interactions with families to the victims that have been identified.
Can you give me an idea when you say services, for example, what would be types of services you provide?
So we will go either directly to, first, unfortunately, we provide a lot of death notification, especially in mass casualty events when there's not just 2 or 3 individuals most of the time who have been killed.
And let's stop for a second and define a mass casualty events. How many deaths?
So mass casualty event for us, if local areas need help, is 3 casualties or more.
Okay.
So it can be as small as 3, it can be as large as thousands, like we saw at Las Vegas, and hundreds at Pulse nightclub.
Great.
So we come in, the victim specialists coordinate with local law enforcement and local services that have identified or started to identify the victims. Some of us accompany law enforcement and the appropriate individuals to do death notifications if those haven't all been taken care of. Others, other victim specialists go to local or regional hospitals to connect with the families of those who are injured. And so that in and of itself is a really complex situation to be in, because you don't know how many hospitals there are, you don't know who's been sent where. And so that's where the victim identification from the very beginning is really important to keep track of, and to start writing down names and information and where they're going. And usually at the reunification location or wherever that initial place has been set up, that's where law enforcement goes and they start to take that information. Once we identify that, if individuals need loved ones that are flown in, we can provide transportation, we can provide hotels, we can provide car rentals. The federal government will not pay for food, so that's one thing that we cannot provide. But I can tell you that every single time that I've been at a mass casualty event, you're not going to lose weight, because there's just so much food and local items that are donated. So then we also bring in service dogs will show up. Certified counselors will come. Of course, there's always the pastoral care that comes in. And then the victim specialist in each of the regions in each office has to know what's available in each of their sites. So they pull in their emergency managers, they pull in local hospital information and staff. So there's a really comprehensive set of players in the field that are going to provide services to anyone who needs them.
And when you talk about victims specifically, I'm sorry, allergy issues going on this morning. Victims, it's victims, their families. Would define a victim. Is this just the families of the deceased and injured, or does it go?
Yep. So there's three categories. There's the injured, present and injured, non-present. So that'd be like the secondary victims, the family members. We do identify them as secondary victims a lot of times. There will be those who are present and non-injured, and then those who are deceased. And the nice thing about being able to access the federal portion of it is we have a pretty broad stance as far as the definition of a victim. If not for this event, would that person have been a victim? They have to be directly affected by it. We're not talking about those who are watching it on TV or those who are not in the immediate area, but those who have suffered right at the source.
So when we talk about the boundaries of responsibility, when we consider the need for services, we've got an ability to take care of the victims, the families, the injured, and then you're relying then on other community services for individuals outside that, the general public outside that. So you're focused.
Right.
So within your services, then, some of these incidents have occurred years ago, but you're still providing services to them. And
a lot of things, one of the things that I would encourage people to remember is that just because the event and law enforcement and everybody has left, the traumatization and the needs don't go away for sometimes a very extended period of time. We're still there. Sandy Hook, San Bernardino, Pulse nightclub, Las Vegas shooting, the church shootings, all of those, not all of them, but a large portion of them are still seeking or getting some kind of assistance, whether it's counseling occasionally or, funerals can be covered. Some of the expenses can be covered federally and also through the Crime Victims Compensation Program here in Iowa, because it's such a great program. But I have individuals who even call me from, 3 or 4 years ago and just say, this is what's going on, or on the, anniversary dates. We have to be very cognizant of anniversary dates in all of these kind of events. The Family Assistance Center in Las Vegas is being stood up for 3 years, because one of the things that we know is people will return to Vegas even if they've been harmed there, and they can go and access the Family Assistance Center. But that Family Assistance Center, the Nevada Crime Victims Comp Program, said we're going to leave this standing for 3 years.
Fantastic.
And we see individuals all the time. Columbine just had a big information presentation on TV. There's Sandy Hook families who are still fighting for gun control. And those individuals are still accessing services so that they can be their best selves.
Okay. And I think that, I guess my point to my question was, as people are planning this, they need to consider, as they put these plans together, that we're looking at the before, during, and after. And
Absolutely.
I think the after piece of this is obviously the role that you play is, right. And that after, as you mentioned, has no timeline. You right. cannot put a timeline on the after. I think you just have to really, really be cognizant of that as a, speaking as a former administrator and superintendent, and just taking care of those families and those staff members as to how long does this, what does this mean? What does it look like? And I think that you just have to be ready for whatever that's going to be.
Yeah, you have to be patient.
Yeah.
You have to continue to take those deep breaths and say, okay, this individual's having a harder time now, maybe than they did initially, or 3 months, 6 months, a year, 2 years, 5 years down the line, they still may have some of the challenges, not at the same level, but we really have to be patient, not only with ourselves, but with others.
Yeah.
And I want to remind, some of our local law enforcement entities that are working with schools, what a tremendous amount of resources you do bring to play. Some of our small rural communities don't have access to some of the resources that you're talking about.
Right.
And so this is a way for them to get those services
Sure.
where they otherwise not be able to access those within their community. That just the financial resources to assist with this response is tremendous to some of our small schools and our small rural areas. So I encourage people to reach out and get connected to this as a resource. You don't have to have all of the answers in your community. And I
Absolutely.
think that's a really important message for
Absolutely.
people to learn.
Yeah.
I agree.
So as we kind of switch gears maybe with our conversation a little bit, in speaking from a perspective of a superintendent or a principal, I picture myself and being in a situation where you may have students who are, who are deceased now as a result of this incident, or staff members, and how all of that just triggers as a superintendent in a smaller community. You mentioned that some of these are going to be community events, not just an event that occurred at this elementary school or whatever it might be. So, so the first priority for me as a superintendent in my thinking becomes those families of those staff members, or the families of those children who have are now deceased because of and as a result of this event. So, so that being my first priority, at what point does that begin to shift? And may be different for every community. It might be different depending on the size of the school, the size of the community. I understand that part. And we talked a little bit about that. And you talked about how, typically on site between 12 and 24 hours and those types of things. But is there any kind of a general guideline you can give, or is it really just going to be individual to the event?
I think it's going to be individual to the event, but one of the things that I've seen that's been the most effective is that the people who have the senior positions, like a superintendent or the principal or emergency managers, the chief of police, all of those individuals, at first the united front is really important. And the other thing that's really important is that the families get the briefings, the families get the information first. Those who have been directly affected get the information before anybody else, before you go and present it to the news, before you do your press briefings, all of that kind of stuff. And the most effective outcome from that is you will see the natural transition of meeting with families on a daily, if not every other day basis, to then transitioning to services for them, you being still supportive and they can still access you. But that natural transition of you going back to not everyday life, because it's never going to be the same, but really taking care of all the other things too. That also provides a good example of allowing others to say, oh, it's okay for me to transition back, or it's okay for me to do this one thing that I used to do. Because people a lot of times hold on to that trauma and grief for all the right reasons, but a lot of times it's because they haven't seen anybody else shift out of that. Okay. So I think as the senior leaders, so to speak, in the group, work with the families, provide them information, and eventually the information is not going to change because we'll have some of the answers. We'll know everyone who is deceased. We know how the injured are doing. That transition period is really important to be represented to the families and the victims in the situation.
Yeah, great point. Yeah, and again, being the role model, being the leader,
right,
seeing
absolutely.
Where do we go from here.
And I think, as you just now said, being a role model and a leader, I've had individuals say, you know what, I talk to my pastor for, every other day now because I need to talk about what's happening for me internally. Because yes, you have this huge responsibility, but you also have to do some self-care. And so if we can mirror that and reflect that back, other people might think, oh, maybe I should talk to a counselor. Or maybe I should ask about where I could go. We have to give ourselves permission to get healthy.
Yeah, I think that's great. That kind of leads to my next question. So, as a district, how do we know we are healing? So maybe some things that you've seen, you've witnessed, you've experienced in terms of, are there observable signs? Are there things that indicate that the school's healing, the community's healing? And maybe it is, being able to see those observable steps of moving forward or whatever it might be. I don't know.
Yeah, it's a tough question. I think that's one of the biggest things. There's so many tough questions in mass casualty events because there's so many things that go, there's so many questions that go along with chaos, and it will be chaotic. It will be, you can plan and plan and plan, but when the event happens, it's going to be chaos, and people are just going to go with what they know best. And the same with re-entering their own lives. They're going to at first come back, and people are going to be walking on eggshells. They're going to wonder, if I say the wrong thing, what's that going to be like? Am I going to trigger somebody in one of my colleagues? Is a child going to start crying? So we have to recognize that we're all doing the best that we can. But what you will see is the evolution of healing coming to the school and to the district. There is a natural process that takes place. And because your body has to get rid of that stress, and it's going to do it one way or the other, good, bad, or in between, and we're going to make choices based on that. And so you might see that some of your teachers don't come back. They're just saying, I can't do this. It's too much for me. It's too overwhelming for me. And you have to provide them that opportunity to either say, well, if you can go to counseling, if you'd like to come back at this point, or, when you make the choice for yourself, that's great. If you can't come, I totally respect that. You're going to experience staff seeing others doing the best that they can, and kids re-entering, into the joking phase and into, messing around at school, or kids actually having fun at recess, whatever the case may be. And so you're going to take those kind of examples, and you're going to start to say, oh, we are much better than we were 3 weeks ago, or we are much better than we were a week ago, and oh my goodness, we've had really 3 great weeks, and it's an ebb and flow. But you're going to recognize the signs that teachers are more comfortable coming to school, that students are more comfortable coming to school, just by the re-entering of the activities that they used to do, and that people aren't always talking about this one thing.
Right.
Yeah. Do you see that same type of situation in communities that are maybe not, where the incident may not be happening in the school, maybe happen in the church, or in the case of Pulse Nightclub? Or how do you recognize that within a environment that's not as structured as a school?
That's a good question. Pulse Nightclub was an entity in and of itself, that there was so many moving parts, and it was nobody really knew who was in the club. In the school, it's kind of more of a closed community rather than an open community that we're talking about. And so what will happen is you either see businesses close if the event takes place there, or they go in and they redo the whole building and they re-energize themselves to come back because they're not going to let somebody else win. And then you also see the community coming together and providing maybe assistance to paint, or to put on a new patio, or refix the lights, or the business then does really well afterwards because people recognize that this is what's been keeping the community going for that long. The Pulse Nightclub also was the LGBTQ community, and they really came together and was our shining example of how that support, not necessarily of your biological family, but of the family that you choose, really helped a lot of those individuals to be successful after the event.
Did you see that also within the church community?
Absolutely, absolutely. The church, obviously, in Texas that had the massive shooting, or the mass shooting, they came together as a community. Other churches were very, very supportive of them. And that's a really good example of living in a very rural, very isolated, socioeconomically compromised area of the country. And they came together and said, we're going to rebuild this inside of the church. It became a memorial for a while. They have, the pastor has started, very quickly after the event took place, he started having church again. His daughter was killed in the event. They weren't there that day. And so the community response was unbelievable. And it's been unbelievable at every event that I have attended. But those that have the exceptional kind of experiences are those that are outside of what we classify large community or event locations that we recognize. The small rural church, the resources that they had were so limited, but within 24 hours, it looked like a big city because of everybody that came and all the resources that were available.
Yeah, good. Yeah, you thinking about, getting back on your feet again, and the right timing of when school starts, and when do you use the building again? Do you, as we know, Sandy Hook rebuilt. I mean, they just started from anew. But, I think a lot of those decisions probably are, whether it's your local school board who represents your community, or your community has some input in that too. I guess is there any advice you might give or pass along as to what's the right thing to do? Or
Well, I think, obviously, the only statement I can tell you is it depends. Like you said, Sandy Hook raised their building. They completely demolished it and rebuilt. They had that opportunity. It was a smaller school. Then they bused children to other locations for school. The community was not going to have those kids re-enter that school. Not every community has that option.
Right.
Yes, lots of monies come in, but there's also ways that the appropriation of that money has to be held.
Mm-hmm.
So I think baseline is that you as a superintendent and the school district themselves have to determine when the school is going to reopen. But that school cannot reopen until all of the glass has been replaced, all of the bullet holes have been filled, all of the school has been repainted. So it is ready and open for class again.
Yeah.
And that, I think of very few schools that could actually demolish a building and rebuild it to help the children and the staff members. It wasn't unrealistic at Sandy Hook because that's a choice that they made, but I think it's very unrealistic in the vast majority of locations because it's just not feasibly, that's not the right word, it's not fiscally responsible, or is it feasible to have that much money to be able to do that?
Right.
So you as the staff and you as the superintendent, you have to be proactive into saying, you know what, we're not able to take our children for years somewhere else and then rebuild this school. But what we are going to do is it will all be brought back to standard. It will look similar, it will feel similar, but it won't be exactly the same.
Right.
And you also have to remember that the vast majority of children and staff, once they leave the building, they've only seen what they've seen. They don't go back in and see all of the destruction, and they don't have any memory of that. So I don't think we can borrow from that memory. We have to recognize that kids are really resilient, and certainly school teachers are super resilient when it comes to their environment. So if you have that expectation of resiliency of your staff, and you have that expectation that, we're going to get this done in 3 months or maybe a month, whatever it looks like, then everybody else will pick up on that expectation that I can be successful going back into this school. And it might be a process too, where you have a reopening and all the families come and they get to walk through and they see it experienced in a really calm setting, really calm environment. They see that it looks new, that it feels different than the last time that they were there. That's important to make that mental shift.
I recently attended a school safety academy in Indiana, and there was an active shooter event that happened in a middle school and in Indiana. And so the superintendent spoke about how diligently they walked through the building as you described, and whether it was a nick on the wall, it was a possible part of a ceiling tile that might have looked not right, or discolored paint, or whatever it was, it all had to be redone because they wanted nothing for any student to walk through and go, oh, that must have been where that happened, or that must have been, they didn't want anything to trigger a conversation that might have led them back to that idea.
Absolutely.
And it was such a powerful conversation, and a real one that they were willing to have with us, that it was so good to listen to. So it was speaking exactly to what you were saying. And what was interesting is that they had the time frame of a Christmas break or winter break that happened, but they had a family night to bring everybody back into the building prior to that school, those kids coming back. And so anyway, just a little bit off of our conversation here, but it was a situation that really reflected what you were just saying. And I think it was really, really good to hear how they approached that. And I think so often, I think we really have to, and I think that all of us that, in education, that are, when we put kids first and we think about what they might see, feel, hear, and think, I think that's probably the right approach to come back and consider when doing that. So good.
And along those same lines, every time that we deploy to a mass casualty event, we actually have site visits for the families of the deceased and site visits for the injured, of those who want to return to the site. If that's done within the first week or 10 days or 2 weeks that we're initially there, some people want to return right away. we set up a perimeter, and there are appropriate boundaries. They can't go back into the site, but they can go back and see it if they want to. And then 6 months or a year later, depending upon what that, like San Bernardino, the regional training center, they completely took that building, the main floor where the shooting was, they took that back to the stud. So it was vacant. It was, there was nothing left in it. And that was probably 9 months afterwards. And we set up a victim memorial site visit. And so the families of the deceased went at a certain time, and then those who were injured went at a different time, because it's two different sets of needs and concerns. But they could actually walk through the San Bernardino site if they wanted to, and see that it had been taken back to the studs and that nothing was left of the chaos and of the destruction. And if they wanted to do that, they could. And so I think that's really important to remember, that those families and the victims have to have something different to refocus from what they left.
Yep. Oh, that's so good. Yeah, that's just really awesome.
You spoke briefly earlier, you mentioned family assistance centers.
Mm-hmm.
Can you tell us, all of these services are delivered within the context of this family assistance center? Tell us, what is that? Who activates that? Is that something I should expect after every mass casualty event?
Yeah, so when we are brought in, we activate a family assistance center, the FBI, the Victim Services Rapid Deployment Team. And so what that is, it's a one-stop shop for any victims or their family members, where they can come in and they can get Red Cross services, they can get information on counseling, they can get Crime Victims Compensation Program information, they can fill out the forms right there on site. The Crime Victims Compensation Program in Iowa is fantastic. They have all 99 counties identified on their website, and in each of those counties, they have listed where you can seek counseling, where you can get medical care, where you can get any of your needs met. And so that, Iowa does a fantastic job for that. The Iowa Attorney General's office has money in the coffers. The Victim Services Division has money in their coffers here in Iowa, which is huge. I mean, we really have one of the best crime victims compensation programs in the nation. So that for Iowa is a huge boon. There's other services that the FAC does. We've had funeral homes come so that people can identify whether or not they need that information, and who they'd like to see, what services they would like to have take place. There's also chaplains are usually there. There's other spiritual assistants that can come in. But any identified need, always we get a huge amount of donations, usually senior citizens homes or assisted care places where people are knitting and they're making quilts. All of a sudden we'll have stacks of quilts. So any victim family that comes in, they get to leave with a quilt, or they'll have teddy bears or stuffed animals for the children. We also have licensed registered daycare available. So it's still in that same setting. The children aren't, the parents don't leave the child there, but the child is actively engaging in some kind of play while the parents are seeking out services that they might need. We try to provide any, service dogs will show up. We had literally dozens of service dogs at Sandy Hook, and to be quite honest, I think I took advantage of the service dog more so than a lot of people did. But there's just so many non-governmental organizations that are going to show up. Medical, even dental shows up sometimes. People just want to help. And so those services, I know what the services are here in the local area and throughout the state of Iowa. So we would just coordinate that. And we've coordinated with emergency managers. Even school systems have all that information ready at hand. So everybody's really well educated. It's just finding the location and have everybody showing up. Now, the Family Assistance Center, we need to be very clear, is for the victims and their families. Community does not go there. People who need services, that's a different piece if they need a community assistance center. And at Sandy Hook, there was a huge community assistance center set up, and Walmart backed up trucks of games and toys, and the chaplains were there, and there was food, and that was kept open for at least 3 to 4 weeks following the event so that the community could go there, and the Family Assistance Center is reserved for those identified victims and their families.
Yeah. Wow, it is so good. I know we've got at least one question that's been brought in while we have been conversing. So it might be appropriate for me just to,
they would like the contact information for the rapid response.
So,
It's a good question.
yeah, it is a good question. So the Victim Services Rapid Deployment Team is part of our Victim Services Division out in Washington, D.C. If there was ever an event here in Iowa, local law enforcement would contact the FBI and say, we need assistance here, we need someone to help us, and then the local FBI would contact headquarters and that would be activated. Yep.
Okay.
It's
Very good.
easy, and I encourage that, if something does
Absolutely.
happen, to make those phone calls.
Well, that is a main reason for having you here, is to make sure that some of those, especially again the smaller police forces that don't have the level of resources that some of the larger city has, know that they can reach out to the FBI, make that call, and get those
Absolutely.
services delivered within such a short period of time. Is a tremendous asset.
Well, I don't think it's, as we kind of talked about before, I don't know that this was something that a lot of us would have thought about, to
Oh,
be
no.
really quite honest
No.
with you. So I think that, thank goodness, Jane, and you guys have a working relationship, and that experience to be able to come to the table and have this conversation is just so incredible. So it's really
And I
eye-opening.
think it's really interesting because, the vast majority of people in Iowa don't even, well, I shouldn't say the vast majority. There's a large portion of people in Iowa don't even know the FBI is here, that we have 4 resident agencies across the state. And that's okay because, you live in a really safe state. You live in a state that has really good local law enforcement. And so we need to recognize that really the Bureau is going to be a force multiplier or provide additional assets in a time of need. But I think local law enforcement also knows that they can call the FBI and certainly talk to an agent and say, I've got this going on. What do you think?
Yeah.
Even outside the scope of a mass casualty event.
Well, I think it's tremendous that they have access to this resource that has so much experience, because we think about this happening in our schools, and to all of us, except for you sitting at this table, all the rest of us in this state have never lived through something like this. We have no idea. And to be able to bring in a resource that has firsthand experience of dealing with this aftermath is tremendous. So
And hopefully you never will. But
Exactly. That's the,
Iowa is lucky to have you, and lucky to have
thanks.
all of the experience that you have. So I would encourage people, if they wanted more information, is there a website? Where can they get more information on this? And
FBI.gov has a lot of information on all the services and all the information, everything that the FBI does. They certainly can reach out to me, Karen, or KP Gale at FBI.gov is my email.
okay.
They're more than welcome to ask me questions, or if they have, concerns, or want me to come out. That's always fun.
That'd be great. You also mentioned a state resource. Is that through the AG's office? And can you tell us what I would be looking for? You mentioned that Iowa has a tremendous compensation program.
Oh, the Crime Victims Compensation Program. You can go to the Iowa Attorney General's website and look under Victim Services Division and pop that up. And so the Crime Victims Compensation Program in Iowa is funded through fines and fees of bad girls and bad guys, and also monies that the Attorney General decides to put into that. But they have, there's a whole list of items that they will provide services for. They are a payer of last resort. So if you have insurance, your insurance would cover it first. And if you have any co-pays or any services that your insurance won't cover, Crime Victims Comp usually will pick up. Whether that's funeral services, medical care, replacement of clothing that's been taken in evidence, counseling, transportation for trial, transportation to go to counselors. Just an abundance of opportunity so that this crime doesn't financially impact you as it has emotionally and psychologically.
And that's a part of this event we haven't even touched on is, when it's all said and done, it's a crime. And then there's the follow-up of all of the interviews and the criminal aspect of this that is a drain on a community as well. So appreciate you reminding us that that's an area we need to think about. Fortunately, that's not an area that the schools have to necessarily plan for, but at least be aware that your staff, your students, in the aftermath of this may be witnesses or be involved in the criminal aspect of this. So there's an ongoing need to support that as well. So fantastic.
Absolutely.
And I think the important thing is that you have to ask. We have to be so willing to. I know the strong will and the community that Iowa brings, that we want to take care of those around us and that type of thing. But there does come a time when you do have to say, okay, we need help here, and we do have
Sure.
to ask, and we have to be
Absolutely.
willing to do that. So I guess don't be afraid to do that. Go
Yeah,
ask and get your
absolutely.
help
Yeah.
you need. And
It's really the only way you do get help is to ask. And that
Mhm.
sometimes that takes a lot of courage to be able to do that.
Absolutely.
Say, I guess
Mhm.
I can't do everything myself.
And the one who goes first can lead the way for so many. So be that brave person that steps up and gets that information.
Yeah.
Karen gave you your email address, and always you can reach out to Rob. All paths lead to Rob, but he's really great about getting us information as well. And so with that, Rob, is
Yeah.
anything else
I
you want to think about
just,
as we?
I don't think so. I mean, we have scheduled one last follow-up webinar that we are going to do on June 11th. Jane and I are going to come back. We're going to help answer questions. We're going to help talk about where do we go from here, and what are our next steps as a school district, and as emergency managers and law enforcement and teachers. Where do we go from here? We put this plan together, and it's been approved. Now what? What do we do from here? So we're going to help talk through that and answer any questions on June 11th at 10 a.m. for our next webinar. But I can't think of anything else at this point in time, but other than just thanks for
Oh, sure.
being
Well,
here, Karen.
the district's in good hands with the both of you and the proactive stance that you've taken. It's very nice to see all of this because not every state or district does this. So
It's great.
it's really been good.
It's been good. So thank you for your time
Absolutely.
today and
Thank you.
providing your experience and expertise. And as Jane mentioned, wow, how fortunate Iowa is to
Yeah, Karen is